Hello everybody, this is Dr. Bob DiMaria with another episode of Ask Dr. Bob. Let's get right to it. Dr. Bob, what are your thoughts on pediatric brain tumors? Very interesting question. I personally have not had any experience with someone coming in with a brain tumor. There's so many different possibilities. I would do some of your own research. It could be a complication from birth. It could the birth process itself. It could be some kind of a chemical challenge. I would love to be able to give you an answer, but I do not have experience with that. Dr. Bob, I have a spondylolysis with an anterolisthesis of L5 and S1. In other words, the lower part of the spine is moving forward. That's the listhesis. Is it safe to rebound? I'm not sure if I would rebound on the little mini trampoline. You may consider gently bouncing on a 55 or 65 centimeter ball. You wanted to know if chiropractic care could reverse it. I want you to know there was a tremendous book many years ago called Managing Low Back Pain by a Canadian osteopathic orthopedic surgeon who really suggested a lot of the pain associated with a spondylolisthesis is actually the articulation of the vertebra above or below. In our practice, we have had many people have spondylolisthesis body signals. We use a drop type of an adjustment. We don't do the traditional chiropractic side posture adjustments. We are not going to reverse it backwards. I have seen people have surgery done with screws in their back, which might give them some temporary relief. Weight loss, bridges, toning up the core, really a good thing to do. Dr. Bob, I have IBS, which is an irritable bowel challenge. I was wondering if it's safe to take blackcurrant seed oil daily. You're 44 years old. You're trying to take care of your body and your health. Well, from my experience, irritable bowel commonly is dairy, wheat, peanut butter, commonly. We also incorporate the FIT test, which is a food sensitivity test. I'd really encourage you to have that done because whatever food you're sensitive to could be the reason why you're having some gut irritation. You may have parasites, which you always want to look for food sensitivity. Great question, by the way. Dr. Bob, would chiropractic help me get rid of my, some people will say tinnitus, some say tinnitus, ear ringing? Okay, we have many patients who come to the office with ear ringing, and it can be caused by a variety of challenges from misalignment in your neck, dairy sensitivity, wheat sensitivity, lack of minerals. I'm going to refer you back to what I mentioned earlier. You may consider having the FIT test, F-I-T. It's a food sensitivity test. See, when you have a sensitivity to food, your body's going to hold on to fluids and it's going to be compressing structures, and sometimes that can result in ear ringing. We also know that neck alignment can impact it. In our practice here in Ohio and in Naples, Florida, we use motion films looking to see the exact motion and alignment of the spine. Very good questions. I'm Dr. Bob DiMaria.